cell receptor causing the cell to grow. I don't know if that's clear, but that's all extracellular, whereas all these other mechanisms are inside the cell. So the monoclonal antibody bevacizumab actually prevents the ligands from attaching to the receptors, causing all the things inside the cell to do what they normally do.
Okay. We've had a lot of questions about, it seems like people have a lot of diarrhea with these medications. Are there any other things that you've heard patients try other than what you've mentioned?
They've changed their diet. Sometimes patients will use, this is, very anecdotal, but sometimes it seems as patients may become lactose intolerant, and so they stop eating cheese and dairy products. But if they want milk, or yogurt, yogurt's very good, but the milk that is lactase-free seems to help quite a bit by just avoiding dairy products. And I don't know if it's a latent lactose intolerance or something that these drugs bring out. But when you start watching your dairy intake, some patients have definitely had a relief of symptoms. I think another thing with Imodium is that you have to juggle it around quite a bit and find the schedule that works best for you. And sometimes it does require daily dosing, even a low dose, just to kind of keep things under control.
Okay. Let's see what's next. Could you maybe talk about some ways, we've had a lot of questions too about water retention and swelling, especially in the feet and legs, how maybe to deal with that or help alleviate that pain?
Well, that's a question that generally I don't see that often with these medications. If the hands get a little bit swollen, or the feet, like say with sunitinib by day 28, after they're on their break, these symptoms go away. You have to be careful and knowing whether or not it's the drug causing this, or sometimes is it the kidney cancer. When you're treating the kidney cancer, that's a side effect that's really hard to treat. But if feet are swollen because you're on these medications, you elevate the legs, you get off your feet. And that's something that you just, maybe have to do more often than you normally would, just to keep the fluid down. But we don't start with, diuretics and things like that.
Okay. Couple questions about the importance of working out, especially with fatigue, if it can help that, or if, it's not good to do with any of these drugs.
What was the first part of the question here?
About working out, exercise with these drugs, if it helps alleviate.
Oh, exercising. Oh, I'm sorry. Well, I think exercise is very important. I think that, walking 3 times a day, in short, if you're having trouble with your hand-foot, obviously I don't want anyone to walk a long distance. But if your feet are okay, then short walks throughout, maybe 2 or 3 times a day are very, very important. I think that the more you exercise as opposed to lying around, you're going to be less fatigued, because when you're lying in bed brings on fatigue, and it's kind of this general feeling of being, feeling weak and tired.
Okay.
There's really no contraindication to exercise provided you're not hurting your hands and feet.
Okay, let's see. Have you heard any types of studies regarding any of these drugs, people that have had strokes maybe beforehand? There was a couple questions regarding that. Let's see. If if it could be negative if they've already suffered from a stroke, how they maybe the right questions to ask their doctors and choosing the right therapies?
Well, I think having a history of a stroke would be very significant um, in terms of information that you'd want to tell your physician about before you would go on any of these angiogenesis inhibitors, because if the stroke is caused by hypertension, and the hypertension is going to be more difficult to treat when you're on these medications, and the last thing that we want to do is hurt anybody. So if someone had a stroke, you'd be really very, very careful in terms of what drug you would choose to treat the kidney cancer. And sometimes maybe you would think about starting at a lower dose and maybe working, your way up. But that's a difficult situation.
Okay. You had mentioned during your presentation about some procedures that a patient might have to have and would have to stop taking the medications. If you could maybe be more specific on procedures that might be the case.
Well, it's really any elective surgical procedure. It could be cataract surgery. It could be extraction of a tooth. I'm trying to think of other things that have come up. Sometimes, anything. Plastic surgery, we always tell patients to stop their medications, always. It could be a repair of a hernia, something totally unrelated to the cancer that people want to have done, but it does require stopping these medications.
Okay. You had mentioned with Toricel specifically that a side effect could be damage to the lung tissue. If someone has Mets to their lung, is there any concern with taking that drug because of the damage it could cause to the lungs?
No. Many patients that you're not at a higher risk to develop what we call pneumonitis if you have metastatic disease to your lungs on Toricel.
We've had a few questions regarding the drugs, specifically Sutent and the thyroid.
Mm-hmm.
Have you seen that with patients?
Yes, definitely. Patients who are on sunitinib, there's